Welcome back. It's time for Your Health. This is a segment where we take about health issues and, of course, the challenges that are faced when one is faced with these issues and perhaps other issues that surround particular ailments, conditions. And today we're focusing on sickle cell anemia. Now, I'm joined in studio by Dr. Grace Kiraka to my immediate right, as well as Victor Sigali. Welcome to the show. Now, I'll start with you, Dr. Grace. Perhaps just tell us, what is sickle cell anemia? Perhaps there's somebody watching at home who has no idea what this condition is all about, and just give us the basics of what sickle cell anemia is.
Okay, thank you so much for having us. Sickle cell is an inherited anemia.
Okay.
It's a condition that it evolved or it developed in sub-Saharan Africa, it was discovered about a century ago, but was probably there for longer. And you inherit an abnormal gene from one parent, so one from your mom, one from your dad. And this gene, it sort of makes you have an abnormal hemoglobin. And hemoglobin is what is put in your red cells, and it's supposed to help your blood carry oxygen to different parts of your body, to your brain, to your hands, to your legs. So patients with sickle cell, if you inherit the two genes, you get an abnormal hemoglobin, which is hemoglobin S. And this hemoglobin S makes the red cells, which are normally round, like a full moon in a healthy person. If you have sickle cell, it's sickle shaped, like a crescent moon. So it's thinner, it has pointed edges, it doesn't carry oxygen as well as it's supposed to. And because they're smaller, when they're passing through like small veins and small blood vessels, they get stuck. They stack up together and they block. So patients with sickle cell will have severe pain when this happens in the bones, like in the ribs, in the hands and the legs. And then also because the cells are abnormal, the human body is very clever, so it's trained to remove what is abnormal. So these abnormal cells get destroyed a lot quicker. So patients with sickle cell tend to suffer from anemia as well. So the hallmark is a pain crisis, what we call a pain crisis, because it is very severe pain, and also hemolytic crisis, which leads to anemia. So you have patients who always need transfusions from very early on in life.
Perhaps is it identified at birth, or what time does a patient or a parent recognize this?
Recognize it. Well, you're born with a sickle cell mutation. You have it from birth, but babies are blessed because you have this hemoglobin, which is only found in babies, called hemoglobin F, and that usually lasts for about the first 1 year of life, 9 months to a year. So very small babies in the first year of life may not get sick, but then from about 9 months, some parents will notice the hands and the legs get swollen, and then the baby's crying for no reason. It's like they're in pain, and they can't speak at that age. So usually just takes a very sharp parent to notice this. The baby's crying, the hands keep getting swollen, the legs are swollen, and then it kind of resolves after a few hours. So if they notice that, then they go to the doctor. They'll be asked if they have a history of sickle cell, which some people have that in their family. They'll remember maybe a grandmom or a granddad told them there was anemia in the family. But for most people, because if you're passing on this gene to your child, you're what we call a trait. You only have one abnormal gene. And patients who have just one abnormal gene are perfectly healthy. They're not sick. So you might not even know, you might not have any family history. But if you notice a child crying and seems to have swollen joints, are in pain, or they seem to be very pale, very white, and then you can go to hospital, and your pediatrician will be able to request a sickle cell test.
All right. Now, I would like to bring you into the conversation, Mr. Sigali. You are what is referred to by some as a sickle cell warrior. You have been living with the condition throughout your life. Could you perhaps give us your story? When was it discovered, and your journey from that time up until now, how you have coped?
Thank you so much for having me here. I really appreciate, and indeed, as you've said, yes, we are referred to as warriors. For indeed, it's a real battle that we are really fighting. Basically, as the doctor has put it, the first year of life is quite normal. And that was also the same to my case. But afterwards, probably from the third year of life, that's when trouble started. As I am told by my parents, because it's quite a long time to remember. But the challenge is that they were not able to get a diagnosis of what I was suffering from. Because when you look at my family, both my parents might be straight, but all my siblings, they do not have the condition.
All right.
All my cousins don't have the condition. So it was a little bit difficult to point out that this is what I was suffering from.
Okay.
Yes, but with time, they were able to come up with a diagnosis. And with time, then been able to be managed quite well.
So perhaps in terms of management, what have you been going through in terms of treatment, hospitalization, and maybe some of the specialized treatment that is focused on people with sickle cell anemia? Because it's not the same as malaria or any other condition. It's quite different in terms of treatment, and it has to be consistent and, of course, aligned with perhaps the crisis that people living with sickle cell anemia face. So could you paint us a picture of what it looks like to manage sickle cell?
Basically, the most important thing in management of sickle cell is to prevent a painful crisis.
Yeah.
If you are able to prevent a painful crisis, then we are doing quite well. However, at times it's not possible.
Okay.
Because of the environment and just basically how the cells have been, they are naturally.
Yeah.
So basically, the first thing, when probably we can start on prevention. What I can say to those people who are living with sickle cell, hydration is quite important. Just keep yourself very, very much well hydrated, because it helps to keep the cells moving.
All right.
Yes, and one of the challenges is of a painful crisis is when the cells get clogged in the blood vessels.
Okay.
So hydration is very important. Hydrate. That's the most important thing.
Yeah.
Extreme temperature also they get told to us.
Yeah. So either very hot or
very hot or very cold. Yes. The weather like
right now
temperature
really,
like today. Yeah, you're showing it's quite cold.
Yeah, the studio is pretty chilly. Yeah.
Yeah. So those are the things which can also precipitate to a sickle cell crisis.
Okay. Now,
so keep warm.
Yes.
Yeah. Keep lukewarm temperature.
What about the medications side of things? Are there? Yeah.
Yes, we have really made strides when it comes to medication. By the time when I was growing up, there was no the antimetabolites, hydroxyurea. However, currently that is the gold standard in management of sickle cell anemia, and it has really come a long way in improving the quality of life of people living with sickle cell. So hydroxyurea, it has really helped in management of sickle cell anemia.
Right.
As the doctor has said, we really have low hemoglobin level. So we also need to ensure that we are boosting the HB level. So in most cases, we'll be on folate. It also helps to boost the hemoglobin levels. Make sure we just get our immunizations right to prevent infection, because infection also helps. It can trigger a sickle cell crisis. Yes.
Dr. Kiraka, I would like to know that he's mentioned anti-metabolites.
Yes.
What are those? For me and the people watching at home who have no idea what that is.
Yeah. Well, these are just medications which change how the bone marrow functions.
All right.
So for sickle cell, we use hydroxyurea, and this is recommended for probably all patients with sickle cell. It's a standard of care, and it's one of the reasons the narrative with sickle cell has changed so much. I think some of the stigma people have with sickle cell is, there were back days when it used to be thought if your child has sickle cell, they won't live to become an adult. They used to get very sick and very early. Now the story is changing. Victor is 38, he'll be 40 in a few years, and we have patients in their 60s with sickle cell. So the narrative is changing because of drugs like hydroxyurea. So what they do is they actually stimulate the bone marrow to produce more of the fetal hemoglobin, the one I said found in babies, HbF, and that is protective. So it actually boosts that, and the bone marrow makes more of that HbF, and that makes the HbS not be so aggressive and not sickle so much. The target is to not have children missing school so often because of crisis, not have them admitted so much. And so the hydroxyurea treatment is very important for that. The other mainstay which which I don't think we can escape, is transfusion, and patients will require regular transfusions because the hemoglobin does keep dropping. And so it's important to know why. If you know somebody with sickle cell, you will always be getting alerts or texts, go and donate blood. If they're admitted, go to your nearest hospital and get blood. And that's one of the reasons.
Okay, so you've talked about hydroxyurea, and I remember a couple of years back, I have a friend who has this condition, and she indeed was complaining of the availability because she lives in rural Kenya, and her name is Joy Watitwa, and she said there was a problem in patients accessing this critical medication. So have those conditions changed, or is it still a problem for some people to access this sort of drug?
The thing with sickle cell is the quality of care. Unfortunately, globally, there are like 25 million people in the world with sickle cell, and expectancy is related to management, and management still is related to where you are in the world. So if you're in the Western world, if you're in Nairobi, if you're in a big city, then the management is so much more better and more, available than somebody who's out in the county, somebody in the districts. And that is something that I think a lot of lobby groups, patient support groups are working on. There was a national task force about making hydroxyurea available as part of the national treatment. The way we say all children have to be vaccinated, and the Ministry of Health, and they were actually pushing for this, and this is something all pediatricians in the country were behind. And so yes, there's definitely improvement in that, because it's not an impossible drug to find. It's not difficult. It's actually a tablet. It's not even an injection. So if you just get it available to the patient, it's very easy to give that. So there have been strides in that area.
And when you look at medication affordability as well as insurance, has it shifted? Is sickle cell anemia something that is insurable, or is there still a challenge with that?
That is a challenge for most patients. Not very many patients in Kenya have insurance, number one. And for those who have insurance, you can imagine if you're a parent with 3 children, one has sickle cell. Even if you have insurance, there's a limit to how much insurance will pay.
And it's a lifelong condition.
It's a lifelong thing. And for most parents, actually, before the middle of the year, the insurance cover has been finished by the child with sickle cell. They just had 2 or 3 admissions, and maybe they had pneumonia. And with sickle cell, you have to be very aggressive with infections. Even if they get like a sore throat, the parents are taught, take them to the pediatrician, don't keep them at home, because it can precipitate a crisis. So the health-seeking behavior is different. So even if you have insurance, it could only last so long. So I think there's definitely a huge room for support for for NHIF, for government support, for lobby groups like that, to at least cater for that, because it's like I said, it's a lifelong treatment. There's nothing you can do about it. But if you manage it well, it does respond. So I think they definitely deserve a chance.
So what would be ideal in terms of insurance services for people living with sickle cell?
Ideal universal health care, universal coverage. Anyone, your friend in the county should be accessing the same treatment that Victor is getting. Victor is lucky he's in Nairobi. So one of the complications of transfusion is iron overload, because every unit of blood you give has a lot of iron. And iron over a long time, because you get 2 or 3 transfusions a year, will affect the body organs. So we offer him an exchange transfusion, which is a specialized transfusion where instead of just stopping him with blood, we hook him up to an apheresis machine, and it removes his sickle red cells and transfuses a healthy red cell from a donor like yourself at the same time. So you don't overload his body with iron, you don't cause a complication, and it's a lot safer, a lot more efficient, and then overall he'll need less transfusions in a year. So that is something which definitely can be made available.
Adjusts, or how does it work that he eventually needs less transfusions?
Well, if you have a patient, for example, if you have a severe pain crisis that is not responding to the regular medication, or some of the other complications of sickle cell, like stroke is actually a complication. It can happen even in young children. There's something we call acute chest syndrome, which is, I guess I would describe it like a very severe pneumonia. If you ever had a patient with sickle cell ending up in ICU, most of the time is a chest syndrome. So sometimes, because the medicines we have cannot work, then the exchange transfusion is just like an emergency urgent thing you do, and you remove the sickle cells, but then you replace with normal blood. So within about 3 or 4 hours, we convert his HBS to HbA just by transfusion, and then that allows his body to recover from the complication. And these are normal cells from a healthy donor, and they will last for about 3 months. So he will actually not have as many crises, and the complication that he was having will clear. So that access to healthcare needs to be universal to everybody.
Yeah.
That's actually the ideal situation.
All right.
Yeah.
Dr. Kiraka has talked about the stigma that comes with sickle cell anemia. Have you experienced it personally, the stigma, in your personal life?
Not really.
Yeah.
But probably what I can say is that the discrimination which might come with sickle cell anemia. For example, when you are to get employment,
Yes.
most employers will be reluctant when you have the condition,
Yeah.
because they will label you as somebody who is a little bit more sickly,
Yeah.
and which they tend to think it might affect your productivity. Yes, but stigma, not really, but discrimination.
Discrimination.
Yes, that happens.
Yeah, because I do have same friend I was talking about. Sometimes her leg has a problem,
Yep.
and there's another person I know who sometimes uses a crutch.
Yeah.
Because and one would imagine that if this condition makes you less productive in a way, in certain ways, physically especially, then we would hope that you would be considered part of the disabled community, so that you are given some sort of allowance or understanding as you're doing your day-to-day. They would understand that this is what you need, this is how you need to operate, but then you can still anyway perform to capacity. Have you experienced this, or with other people that you know?
Yes, I've, when I was to get my second employment,
Right.
it really came out very strongly. My first employment, it was quite easy.
Yeah.
Yes, and personally, I'm the one who was afraid of it. But after we did the lab test, the doctor told me, no, this is normal. This is normal. Don't be afraid of it. You just wait for the HR to give you a call, and everything will be fine.
Okay.
But when I went now for the second employment, they said, no, you have sickle cell, and the other thing is that we are seeing your heart is a little bit enlarged.
Okay.
So when but at that time I'd already read. I was quite more informed about the sickle cell, about my condition, and how to manage it.
Yes.
And I told them, now if my heart is enlarged,
Yeah.
what does that mean? Would you want to check further the functionality?
Yes.
As in, is it affecting
Affecting
me?
your
Yes. So
work,
we went further and did an echo, and after an echo, everything was fine, and I was able to get the employment. Probably that might not happen to any other person.
Yes.
Yes. So I tend to think that aspect, it's really come out quite strongly.
Yeah,
Yes.
of course. And of course, still with regards to stigma, I have talked to some people who would tell me that you find certain hospitals that lump sickle cell patients together with HIV/AIDS patients, together with cancer patients, and they would feel a bit uncomfortable, because these are also conditions that have their own set of stigmas in society. So if you're lumped all together in a hospital that perhaps they don't have the sort of capacity to handle this kind of patients, so they say the chronic diseases one side. Have you experienced this, and what would you say is the situation right now? Is it the same? Because this was a few years back.
Okay.
Yeah.
Well, I think the idea of putting patients together, like for example, I'm assuming you mean like a general ward.
Yes.
I think the idea for our institution, we have general ward for medical patients, and then we have the surgical ward, and then intensive care. So there's no cancer ward, there's no diabetes ward, there's no HIV ward, you know, and I think that is probably the practice in most hospitals, because we don't want to discriminate.
Yes.
Healthcare is the same, nursing care is the same, medical care is the same. And I think the push towards destigmatizing these conditions, because it's just a chronic condition like any other condition, like diabetes or hypertension. You get sick once in a while, you have to go to hospital once in a while, you get treated, you have a doctor who follows you up.
Yes.
So I think also removing the whole idea that you have to keep people in a special room or you have to sort of isolate them, I think that idea has been removed. But that said, you definitely need to accept that every unique patient population will require specialists to see them.
Right.
So I think wherever hospital you are, whichever part of Kenya, to me, if you're able to access quality healthcare, if you're able to access a specialist who can treat sickle cell, and for sickle cell for both adults and children, they have hematologists, pediatric hematologists and adult hematologists who deal with blood disorders. If you can access that, I think that would be a good start. And we just make that, a countrywide thing. That would be really good. And then now once you're in hospital, then now we can start sorting out
reaching out to
the
us.
other issues. I think we're actually dealing with an issue where patients are not even accessing that. And I think that discrepancy of depending on where you are, you get better health care. I think that's a really, really
and
big
you did
problem.
explain, that it is something that can be managed. So before you're talking about the wards and who we are, the clamping together, we can actually handle this particular condition before it gets to that point. So in terms of diet and living conditions, how is a sickle cell, maybe a parent who has a kid who has sickle cell, how are they supposed to handle their food and their basic needs? Because you can just handle them like a normal kid. So what's
well, I think we are handled pretty normally, but I do think the one thing you do need to remember, I think the only unique thing I would say about diet in sickle cell is because of the regular breakdown of hemoglobin, you tend to have anemia. That's why we give folic acid. So we tend to give a bit of preference to foods and medications that boost the bone marrow and boost blood. So a well-read parent, a well-read patient is always a very good asset, because they will read up and they will think, spinach has B vitamins, vitamins is good for the bone marrow, iron is good, they will know red meat is good with folate, green vegetables have folate, and so they know what specific nutrients you would need. But if you're eating a healthy, well-balanced diet, I think for sickle cell you will be actually pretty okay. I don't know what's Victor's experience. He's actually
with the diet.
Exactly. What she said is exactly what we normally practice. We just get normal well-balanced diet, but on top of that, we just have to have an increased feeds with iron, the green leafy vegetables, liver, organ, red meat, such kind.
And what about physical activities with the children? What about PE and games, or should we handle them like eggs and just try and make sure that it's nice and safe?
Not really like eggs. Just allow the children to, because every child has their limit. But what we just need to know here is that exhaustion, it really can trigger a crisis. So let them know their limit. But we really, actually, we don't expect somebody with sickle cell to be in the field in football, rugby, that kind of sport. Let them.
That's extreme.
That's quite extreme. Let them take that which is a little bit more friendly to them.
Friendly to them, and they can just gauge themselves. And I want to take you back to the conversation of the workplace. I would imagine that just like extreme physical exertion on the body, also stress has its own factors when it comes to sickle cell. So how would you handle stress just to make sure that it doesn't make you sick or exacerbate your condition?
Yes, you're quite right. That stress indeed is also a trigger of a sickle cell crisis. So just personally, I'm a nurse. There are indeed quite stresses, quite things which can stress you in your workplace. So basically, counseling really helps.
Counseling?
Yes. Get to a counselor, talk about your issues, get a support group, talk your issues. Yes, it really helps. Get somebody whom you can share your issues.
And preferably somebody who understands?
Somebody who understands. Personally, we have a support group. We are 3 people who are living with sickle cell. And we keep on sharing our experiences. And at times we just laugh about it. Yes, don't take it so much serious. Don't take it too much serious. Just laugh about it. As in, it's something that you're already into it. You can't get out of it. Just have to fight it.
And speaking of people with understanding, you say you are a nurse. When you work perhaps with patients who have other conditions or perhaps sickle cell, has this aided in you helping them even better because you have an insight into what they're going through?
Sure. I can remember of a patient who was, the child was diagnosed with sickle cell. And apparently the doctor just sent him, I attended to the patient when I work in maternity. I attended to the patient when she was in maternity, and the pediatrician sent him back to me. So we had a conversation with her. I told her, no, I have sickle cell. You see, I'm an adult. And out of that conversation, she really...
So she had given birth to a child with a condition, or was it her?
Yes. The baby was diagnosed with sickle cell. That was around 4 to 6 months later on. And the pediatrician sent her back to me.
Yeah.
Yeah, we had a conversation with her, and I think it really helped her. From that point, she looked at sickle cell in a very different perspective. Yes, because your psych also really helps in the management of sickle cell anemia.
Yes.
Yes.
And I would imagine that a lot of parents are very fearful of the mortality rate. And the Dr. has told us that people are living just like you, well into their 30s, well into their 60s. And did you have a difficult time convincing her that this is just not some sort of death sentence? You can actually live a long, healthy, productive life.
Yes, because even the first time she thought that it was just this has been stage managed. This guy can't be having sickle cell.
Oh no!
This guy can't be having sickle cell.
Yeah.
But so we talked. She was quite inquisitive. How often do you get this crisis?
Yeah.
But by God's grace, I've been able to. As in, is it to avoid? But I've not been able to get the painful crisis for quite some time.
Which is
yes,
wonderful.
We can talk of many years.
Wow.
Because the last time we had a crisis was in 2015. Yes. So before that it was around 2006. So you see, it's quite well manageable.
Yeah.
We had a conversation.
That is surprising even to me, because I imagine sickle cell patients are always in wards, always being being handled for a crisis.
So that is also another myth which you need to demystify about it.
Presentation
it doesn't mean
is very different in different patients, and you can't really compare one patient to
the
another.
other,
Some patients, I think with Victor, tend to have more anemia and more hemolysis, and so very few pain crises, and other patients will have more pain crisis.
Okay.
And so it depends on how the disease manifests.
So it's just a question of management and more management.
Yeah, so you have to understand what your patient is and how they do. And I'm glad you mentioned about the parents, because family support is one of the most important things we see in sickle cell, even in coming to donate blood when the patient is admitted, being given time off. I know one of the stigmas you mentioned was the patient themselves, but imagine the parent who has to keep asking for time off work to be admitted with a child. Every time the child is admitted, one of you has to be there. Exactly. So that support, the support groups exist for patients and for family members of patients with sickle cell. And then when you talk to other parents, they kind of help you through it, because it's a family, especially when the child is young. It becomes a family thing, and it's really good to get that support from people who've gone through it, and then they can help you out and help you get away forward.
Right. And Victor did tell us when he was younger, his parents were looking to his family and nobody had the condition. So it was difficult to tell. And I would imagine a lot of people face the same problem. And you did indicate, I don't know if I'm getting this right, that at least both mother and father should have the trait, so that they could have a kid who
pass it on.
There's that risk. So how do you know if you're a healthy adult and none of your parents have stories about so and so who had it, and neither of them has the condition? So how do you tell that this is a danger? Or perhaps one of you has it, so you want to make sure that
in a country like Nigeria, I think the sickle cell trait in some areas is 30%. So 3 out of 10 people carry the trait. So like the way in Kenya, if you're getting married, it's law to do a HIV test. It's law to do sickle cell test to find out, so that in advance if you're at risk, because both of you need to carry the trait.
And
we don't have it
mentally ready.
So then you're prepared, and then because like I said, the gene could be passed on and nobody gets sick until you meet somebody who equally has the gene, and then and this just helps to diagnose a child early so that they can start getting treatment early, and like you said, then you're psychologically prepared for it. The other way which it can be done, we don't do it here, but other countries have a newborn skin screening program. So all babies who are born right at birth, they have national screenings, so they check for HIV, hepatitis, thyroid disease, and they check for sickle cell as well, in addition to other conditions which babies might be born with. And then you can pick up newborn babies, and then the ones who do have sickle cell, you can refer them to the appropriate health services for that. So that would be the ideal way, because then it allows just nationwide screening. We would know which parts of the country are more affected. We would know if we have more cases coming. We would offer treatment very, very early, and even the counseling you're giving to the parents, I think it's a lot better if you're prepared for it very early on as opposed to later.
And Kenya is quite progressed medically. This test is available.
It is routinely available. I think now we're doing it on request or on demand. So pediatricians will review babies at 6 months, after birth at 1 year. So if they notice anemia, the HB is low, the child is not developing as they should, or they're getting signs of jaundice early, then they will request it and send the patient for HB electrophoresis.
And perhaps back to the tribes and the communities that we can form. Perhaps somebody who's at home who has not had access to this sort of people or group or community, what would you advise? Where should they start? Is it church? Is it online? How do I get these communities to be a part of, so that they can help in just being strong mentally and
this is
socially?
Patients with sickle cell or people at risk?
People with kids, people
we were taught years ago that concentration of sickle cell is if you're from the coast or you're from Western Kenya.
That is true,
and that is how it was. And this is areas which are across the equator, which is where malaria is endemic, and that's how it was thought. Sickle cell, developed to protect people from malaria. It was thought, years ago, that's what happened.
Of some sort.
And that's still mostly true, but because of intermarriage, traveling, people, living in different parts of Kenya, I don't think that's strictly true anymore. We have lots of sickle cell being picked up in Nairobi. We have sickle cell in Rift Valley, in Kisii, in Ukambani. So I don't think that works anymore. So I think a newborn screening program actually would be pretty useful. But I think if you do have a good follow-up for newborn babies, if you have a good support system, if you have a good pediatrician following up, it will be easy to pick them up in the first 1 year of life. And offer the test available to patients. If you have a family history of sickle cell, you have a cousin or anybody in your family, or even if it's just a grandmother who mentioned that her children used to die young back in the day with anemia, I think that's a population that would be useful to be screened for sickle cell.
Okay, Mr. Sigali, you said you have 3 friends that you commune with and talk about this. How did you come about them? Because people might need to form these groups, but they don't know how to find friends who they can talk to and share and feel connected to and strong. So how did you come about this, and what would you advise somebody at home to do in order to locate people who might be having the same problem or challenges, so that they can share and be strong?
That's somebody said that once you start for example, you start training, exercising. If you, for example, you start jogging in the morning, you'll keep on noticing people who jog. If you have a weight, when you're on the road, you'll keep on noticing there's a weight. So actually, one of the friends whom I met, she was a patient actually. Yeah, she was a patient, and then we just connected. I was by that time I was just gone to A&E to assist. I happened to meet her, and then we connected. We exchanged numbers. After that, then she introduced me to the cousin. Yes, and then we just formed a team. Yes, so after that.
So perhaps being open and just talking to people, this could lead you to the right people who you can
and then there's also a support group. The Sickle Cell Foundation of Kenya. There is a WhatsApp group. There you can get quite a number. It's only that.
And on Facebook also, the Sickle Cell Children Foundation. I think they're organizing something for World Sickle Cell Day next week, 19th. So there'll be a walk, and they have information on their Facebook page. So I'm sure there'll be a lot of patients and family members with sickle cell who will be attending. So if you want to meet people, that will be a good place to start.
That will be a good place.
That will be a good place to start.
So that's an event that you need to look.
Don't stay alone at home. Get out, mingle with people. Get success stories. Know what other people are doing. And I think it will come a long way in helping in the fight of sickle cell.
And I think also it gives hope, because sometimes in this situation you just need hope to know that, so I can take care of my kid and he can live a productive life, have jobs, and just be normal and not extremely dependent, even though you have said you shouldn't compare, but at least it gives hope, right?
Yeah, you could get advice, you could get support on that. And some patients, unfortunately we do lose patients to sickle cell.
Yes.
And I think you still do need that support, you still need the counseling help, because I think for most families they have other children with sickle cell as well, so you can't give up. You have to keep fighting, like Victor said. It's something we have to deal with. It's our condition. It's an African thing.
It's an African thing.
So we need to be at the forefront of this.
And do you think that a cure is too far off in the future?
No, I don't think a cure is too far off. Actually, definitive cure has been tried, and that's a bone marrow transplant.
Yes.
And where in the centers where it's available, and that's basically they just take a patient with sickle cell, give him chemotherapy to basically finish off his bone marrow, and then get a match who's a perfect match, a family member with healthy hemoglobin, and then give those stem cells to this person. And the challenges to that, number one is giving high intensity chemotherapy to a patient with sickle cell is not usually...
because they're already vulnerable.
They're already vulnerable. They don't really respond very well. So you're already very concerned at the risk of that. Number two is if I need to find a healthy donor who's a match, that's usually a sibling, but the sibling might also be a trait. The sibling might also have sickle cell. So then even the people I'm looking for, the pool is small. If it's an only child, So medicine is trying to catch up with this. They're trying to introduce regimens which don't use very strong chemotherapy. I know Johns Hopkins is working on that, and they've been successful in a few cases. And they're also trying to match patients, not 100% match, like a 50% match. So you can use a parent, you can use a sibling. And so where it's available, it is being worked on. But I think it's kind of a good thing or a bad thing. We're having really good success with hydroxyurea and folate and transfusion. So before you expose a patient to a risk like a transplant, you have to balance out. So if you have a patient who's doing really well, like Victor, really well on treatment, do I want to expose him to a transplant?
And take the risk.
And take that risk. So I think it's still being reserved for patients who are still very, very sick, who start getting strokes very young, who are not doing very well. And then you have to balance it out. So you would still have to talk to your doctor and just weigh the balances and see.
And lastly, I would like to talk about parents who feel afraid of exposing that their kids have sickle cell anemia. What would you say to such parents, Victor? Because there's still a bit of fear surrounding sickle cell, and some parents don't want to tell anybody that my kid has this condition. What would you say to them?
What I can tell them is let them come out. As we have said, once you come out, you are able to get success stories. You're able to know what other people are doing. You're able to interact with people. You're able to get even the latest on what is happening. Yes. Let the children come out. Don't expose. Don't hide them. Don't hide them. Let them just come out and. I believe with time, because actually we've really made strides in the care of sickle cell. During my age, when I was growing up, hydroxyurea was very. It was
difficult to find.
Actually,
yes, it was difficult to find it, and it was even. The ones who are using it, it was very few people are using. Currently, it's the gold standard. We have. Apheresis, which has come up. Apheresis has come up, and it's really doing a good job. It's really making us to live a normal life.
And that is the goal at the end of the day.
That's the goal standard.
So we've been told management, hydration, be open, talk about it, find your community. And of course, next week on a day like this is World Sickle Cell Day, and you can find the event where it's happening. What did you say it's happening?
Children's Sickle Cell Foundation.
The Children's Sickle Cell Foundation on Facebook will get you more information about that day. And of course, you can form communities and just feel like you're not alone and get stronger as you help these sickle cell warriors handle that particular condition. But that wraps up our segment of Your Health. When we come back, we'll give you some international news as well as the docket.